another talk about your health. And today we're going to be discussing two major issues. One, we're going to talk about the social work system here dealing with foster care. And I have Kanisha Harris here, who
Kanisha Anthony.
Anthony, who has told me, Miss Anthony, who's told me, don't call her her social worker. And could you tell us why?
So, social work has a stigma attached to it when it comes to this system. And a lot of people don't really understand what the entire aspect of the child welfare system do. So, I like to not only call myself a social worker, but a child welfare professional.
I love that. I love that because for me, when as a physician, when we hear social worker, we think, oh, okay, them kids need to be taken out of that house. Let's get a social worker on board,
Right,
or
right, right.
and so tell us a little bit more about what you actually do as a child welfare specialist.
As a child welfare professional, we connect families with resources. And when I say family, I mean whether there's a mother, a father, a aunt, a non-relative, anyone who is in the life of a child and responsible for the welfare of that child. So that is where the misconception comes in. We don't just take kids from parents. We put services in place and refer services for a problem that a family may have that they don't know how to resolve on their own.
So tell me a little bit about, you say you don't just go in and grab, but what kind of conditions would have someone even contact you and your organization? Why would someone? Because most of the time we think, oh, that mom left their child, or they're not getting food, they're not going to school, and then
And
after a while,
those are aspects. So the broader term would be your child will be removed from you for abuse, abandonment, or neglect.
say that again.
Abuse,
Hmm.
abandonment, or neglect.
Okay, break that down. Abuse would be like just me slapping them, or like,
Extreme physical abuse, mental abuse, emotional abuse.
okay,
Neglect would be, and neglect is a very tricky one
okay,
because the correlation between poverty and neglect is so
yes,
slim that you kind of don't know. Decisions are made. So if your house is have extreme field, the children are not attending school,
right.
your child have a medical condition that needs imminent attention, and you fail to take your child to the doctor. Those are things that can have that acts that causes that falls under neglect. Abandonment is, yes, your child is at daycare and the daycare is closing, no one can get in contact with you, and you just left your child. Or simply telling the courts, I no longer want to care for my child.
Right.
Or relatives can get charged with abandonment as well. So if you are a guardian of a child and
Yeah.
you just tell a child, get out my house,
Really?
you can get charged with abandonment.
What? So I have a child who's living in my house,
Hmm.
and they're acting up, and I tell them to leave.
Right. And you can't
And
come
we're not
back.
talking child, we're talking teenager, 15, 16.
This is 17 and under.
Okay, so the number we're dealing with is 17 years of age.
Yes.
Anything less than that, it would be considered abandonment.
Right.
Wow, okay. So what's the recourse if we have a child that's, um, as you said, a relative may be taking care of this child, and they can't do it anymore? Is that a time when they would contact your agency?
You can contact the Department of Children and Families and reach out for services. So there's different avenues that you can take, and some people just truly reach their breaking point, and that's just being honest about the situation.
Right.
And the child can go into foster care, or you can identify another relative that may be willing to take in that child. But the first line of action is always to put resources in place. If a relative is taking care of a child, that means that the child was removed from their birth parents. And when a person is experiencing that, then they can be experiencing emotional
Mm-hmm.
things. Finances could be a problem within the home because due to the family social economic services, like how do we connect that child to resources, whether it's sports, to express themselves and get out what they're
Right.
feeling so other people can help them.
That's a really good thing. So it's not just snatch and grab kids.
No,
I
it's
love the
not
term you
snatch
said,
and grab.
connecting resources, because you're right, especially in the African descent and Caribbean communities where we know statistically poverty exists. We know statistically resources are not often available, or at least not we're not aware of them. And so a lot of children are in situations that an interventionalist, someone coming in, could just assist, which is what I'm hearing that as a professional, that's what you do. But then we move into another stage, which is the foster care. The foster, when you go into, which is the next step, I assume.
So then, so what you're trying to articulate
Yeah.
is you go into the foster care system once a judge deemed that abuse, abandonment, or neglected was found,
Okay.
and then now you're into the foster care system. So now placement have to be found. What I think you're hinting at is licensed foster placement when a person who's a foster parent is waiting for the system to contact them to say that the child cannot stay in the home with the parent. So another misconception, you can be still be in the foster care system and live with your parents, right?
Really?
The
What, you
your
got to say that again. It's so important because you're right. It's a big misconception. Why is that child still in that home?
right, with supervision. So the
Okay.
department will still be involved in your home.
Okay.
It means that there's not it's not impending danger. There's not present danger
Okay.
with that family, but the mother still needs some assistance, and the children and the family needs to be monitored to ensure the children's safety. And that goal would be you'll still get a case plan, and that goal would be maintain and strengthen. Now, if present danger is if that's impending danger, sorry. But if present danger
Yeah.
appears, then a child is removed from the care and custody of that parent. Relatives are the next line of caregivers, and if a relative cannot be identified, then licensed foster care,
Okay.
which is a licensed foster home, a foster parent, what people mostly know.
If a relative makes a decision to assist with a child, do they have to become licensed as a foster parent, or um, is that bypassed because they're a relative?
No. So you don't have to become a licensed foster parent. However, there are different level of licensing and background checks that the system definitely recommends. So the goal would be once you're removed, the goal for your parent would be reunification. So now what they're called permanency goals.
Okay.
So we always we strive to find a permanent living situation for children.
Yes.
And let's say you can't be reunified with your parents, your mother or your father, and your relative needs to become level one licensed or level two, which is the highest licensing level,
Okay.
which triggers the system to provide particular resources to that child.
Okay. So you get different resources when there's no
Right.
reunification. That is not going
No,
to be
you
possible.
get it's not different resources, but it's the assistance that a substitute caregiver would need to care for this child.
I
And
understand.
also the child. So we talked about that 17 years of age, right? So you're 17 years old, you're not going to be reunified with your parents.
Yeah.
Your aunt is caring for you,
Right.
but your aunt didn't birth you, so she didn't prepare for you to go to college. Like she hasn't been saving for birth. But if you're in
Exactly.
her care, if you are licensed level one or level two, then if the child is out of the care of their parents for more than 6 months, then you go to college for free. That's a resource that is
Repeat the
provided.
free word again.
You
How does
go
that
to
work?
college for free. So the department, the
Nice.
state of Florida,
Lovely.
offers children who age out of foster care the resource to go to college for free. Is called a tuition exemption, and I utilized it, and I have a master's degree.
Yay.
Yes.
And you know what? I Now that we're talking, and this is not the first time we've met, and I was so impressed because I want the audience to know your story, because you didn't just wake up and said, "Hey, I'm just going to be a professional in this area." You have a story. Could you share briefly your story?
So at the age of 4, well, that's Dr. Powell said, my name is Kenesha, and at the age of 4, I was removed from my mother and my father by the department due to their substance abuse. So, my mother and father were charged with neglect and abandonment.
Okay, so they had three, almost three of the things that we talked
Two
about.
out, two out of the
three
three.
that you talked about.
And I was never able to be reunified with my parents because they didn't engage in services. The system, when I did review my file, I don't think that the system. So just to give a little context here, right? I'm 33 years old.
Oh, and by the way, if you want to know more about her story, she did create almost a blueprint that people can use who want to know more about foster care. So I just want you guys to know that she does have a book available for assistance that you can learn a little, and it's called Labeled, and she can go a little bit into.
Yes, so it tells you more in depth about everything that I'm telling you now. Not being able to be reunified with my parents and how the system engaged with my family and how we engaged back with the system and what does that actually look like for someone to grow up not in the care of their parents,
Wow.
aging out. What are the struggles? What are the challenges? And that's everything that is included in the book. And most importantly, people like Dr. Powell and philanthropists who give opportunities for us to share our stories and shed light on resources to provide opportunities so people who come from this experience can thrive later in life.
Yeah. I'm so glad you created this book. I'm glad that you took your life experience and utilized the resource of going to college, and not just a bachelor's, she has a master's degree, which is amazing. And I'm glad you're sharing this because there are families out there who do need help. They're struggling. They don't know what resources. They're family members who want to help and don't know how to help. And so if someone's near, who should they contact? How should they get in touch with the system to help, not so much do the snatch and grab method? How they use the system in a positive way as opposed to continue to reflect in a negative way?
To utilize the system in a positive way, right? I want to put it this way. It has to be your mindset and your willingness. And that's just me being completely honest about engaging with the system.
Yes.
From my own personal experience, you know, when you talk too much, it's like opening a can of worms. So a lot of our families are like, what happens in our house stays in our house, because we're probably not ready to face what's going on in our homes or someone's else opinion of what's going on in our homes. So I would say engaging with the system is to be completely honest. It may be hard. You may have to go through some hard steps because there's maybe some things going on that's hard. But just be willing for change within yourself.
Wow.
And then I think that if you engage with the system in that manner and you want help, I think you can have a greater result than the horror stories that are out there. And just always, even through this process, even as beautiful as that sound with the horror stories, I would tell people, listen, speak up for yourself, advocate for yourself. The number one person to always speak with is your judge.
Right. Wow. Okay. And some people are so afraid, usually afraid of that. You know,
to speak to the judge.
No, to be in court, and it's kind of intimidating that because there is so many horror stories that it's going to have an adverse outcome, something that they can't handle. But I'm glad to hear that you, first of all, took something that was challenging, you utilized the services available, and now you're contributing and giving back to people in similar situation and creating a positive environment and created a handbook to help people. So,
what I will say is this: the number one thing that you should know about the dependency system, you will not go to jail. That's not the end. The end result of this is not going to jail. It can be termination of parental rights from a parent for their child, which is another delicate and intricate result. However, the result when you're standing in court, you know, most people they go to jail. Like you're not going to jail unless you belligerent in court and do something that falls under the criminal law. But you're not going to jail, and
Well, I'm so grateful that you came today because you say, what? Well, Dr. Powell, Councilwoman, why did you bring this topic up as part of Healthy You? Well, this is the month where kids are going back to school, and our focus is on our children and giving them the best life possible. And there are there are many children out there who need intervention, who need the assistance. And for anyone who wants to participate and help a child, please get in touch with one of these services so that you can lend your support to them, because we do need to start and again continue the village at work,
Yes.
raising an amazing group of future children who will be adults that contribute positively to our community. So thank you so much. We
Thank
appreciate you.
you.
And we're going to hear some more later. And I'll bring you back so we can talk a little bit more about the other stuff that
Okay,
we
I
talked
love
about.
that.
Thank you so much. Thank you. And our next guest will be from Senator Chevron Jones' office. And he is going to discuss with us. We have some really cool things happening this month of September. And September, yes, of course, was Grandparents' Day on the 7th of September. But we're also celebrating and bringing recognition to prostate cancer. And so we have a guest here from Senator Jones, who has decided to team up with me, Councilwoman Powell, to give recognition. Could you introduce yourself?
Absolutely. Good afternoon, everyone. My name is Kai Gorell, and I serve as a legislative aide with Senator Chevron Jones, and thank you for having me.
Thank you so much. So what Senator Jones have decided to do, because there came to his attention one of our members of our community who had prostate cancer. And the month of September highlights and bring identification and information about prostate cancer. And so the color is blue, by the way, that's why you see me in my blues. But more importantly, we have some major statistics about prostate cancer. We know that African descent and Caribbean descent individuals are 70% more likely to have prostate cancer. And not only are they likely to have prostate cancer, they're more likely to die from prostate cancer. So could you tell us a little more why this was something important to Senator Jones?
Yeah, absolutely. I think, as it pertains to health as a whole, a lot of times men in particular, specifically black men, we don't go to the doctors, right? Now there's various reasons for that. And I think this event is kind of centered around highlighting that. Remembering those who have tragically lost their life to prostate cancer, but also educating individuals about the importance of going to the doctor, getting checked up,
Yes.
and making sure that you're staying on top of it. Listen, we only have one life, and it's important that we take care of ourselves until we're called home.
Yes. And what day is this event?
This will be happening on September 20th.
And location, where this going to be?
We'll be doing this at Betty T. Ferguson.
Okay, so we're going to be Betty T?
Correct.
Okay,
Yeah.
so we're going to have a walk starting at what time? 8 in the morning?
8 in the morning. Yep.
Whew, okay, so get up early, and we'll also be taking a look at ending sickle cell disease, working with my councilman, Stevens, we're doing a combined walk for prostate cancer as well as for attention to sickle cell disease and looking for the cure. But let's talk more about prostate cancer. We mentioned that African descent people are 70% more likely, and you mentioned that the reason we're dying more is because, like you said, men don't go to the doctor too often, right?
Yep.
And not only that, we don't talk about it. We're not talking about it. And I'm so glad that Senator Jones decided to say, yeah, let's talk about this. Because there's so many of my patients whose family do not know they're being treated for prostate cancer.
Yeah. And this is, I think, as it pertains to healthcare as a whole, sometimes there's a stigma around it. And I think we need to kind of put all that to the side. Again, go back to what I initially said. We have one life, and it's important that we take care of each other, or take care of ourselves, because we have people who care about us, right? And they would want you to go and seek out that help. And it's important that we share this message. It's important that we have our elected officials who are being vocal about this. Because it does matter. It does matter. Everyone is impacted some way by someone's health, whether personally or in the workspace, and we just need to continue having that conversation.
Yes, thank you so much. And for my audience, let me give you some medical stuff as a family physician. First of all, the digital rectal exam that so many men are afraid of, we can bypass that because there's a screening test. It's a blood test. And not only do we have a blood test now that can check the what we call the PSA level, the prostate specific antigen level. It's a blood test. Um, 4 and above should be paid attention to. But there's also genetic testing now that's available where you can do a swab of your saliva in your mouth, your cheek, and we can do a screening process. Who would get the genetic testing? Anyone who has a strong family history of prostate cancer, because we've seen where prostate cancer runs in families. Okay, grandfather and fathers and sons. The other thing I want our audience to understand is that signs that you should pay attention to. Are you having urinary frequency? Are you going to the bathroom? And when you go to the bathroom, do you not quite feel like you've emptied your bladder? You're going, you leave, and you feel like you have to go again. Have you noticed any blood in your urine? You should not have blood that's visible to your eye when you urinate. Changes in your erection or sexual function is something to pay attention to. And of course, back pain that can't be explained from working out or heavy lifting, maybe something concerning the prostate or maybe advancement. Because sometimes when prostate cancer advances, where it spreads to other parts of the body, you will have back pain. So please pay attention to urinary frequency, changes in your urination, blood in the urine, not even being able to urinate. That's also another thing. And talk to your family members. Talk to them if they've had prostate cancer or there's a rumor in the family that grandpa had prostate cancer, and get yourself checked out, especially if you're over the age of 40 and you're African descent, because the recommendation is 45, but with African descent, you want to go earlier if you have a family history. So I'm so glad that Jones is actually taking this step to be a trailblazer
Absolutely.
in bringing this recognition, especially to our community.
And no better partnership than with a doctor who's able to kind of provide these statistics and information. So I appreciate you sharing that with even me, who didn't know some of the information you just shared.
Well, I thank you so much for coming.
Absolutely.
And if you want to share, just support, please come out on September 20th over to Betty T. We're going to be running the track. Well, not really, walking the track in support of prostate cancer as well as sickle cell eradication. And I think we have a question.
Yes, you do. So let's focus on how to prevent being exposed to cancer, like living around trash.
Okay, so the question is, does our environment play a role in cancer? Most definitely. And I would even go further than that. Prevention is always better than cure, right? There's certain things you can't avoid, like genetic things, but you can live a lifestyle that's conducive to good health. Eating right, avoiding fried, greasy foods, avoiding toxic substances like excessive alcohol use, tobacco use, smoking frequently, illicit drugs. These are poisons to your body. And we know that when our body is fighting to stay clean and functioning, it allows for things and organisms to come in our body that can damage us and make it difficult to repair cells. And what cancer is, in case you don't know it, are cells that have decided to go renegade. They're growing out of proportion to the way they're supposed to be. The prostates, which should look almost like an acorn, now decide it wants to be a grapefruit. And it just keeps growing and growing, which is why there's so many symptoms related to problems with urination. So thank you, my listener, for mentioning lifestyle matters. Lifestyle matters.
Absolutely.
And not just any lifestyle. We want a good lifestyle, eating right, exercising, sleeping well, decreasing your stress, and creating an environment that's clean. So thank you so much again
Absolutely.
for coming
Thank you
out
so
and
much,
talking
Councilwoman.
with us. And please join me again for our next Healthy You podcast, which will be in October, our very first month, our first Wednesday at 1 o'clock. And we'll be talking about breast cancer. All about breast cancer and prevention of breast cancer. And if you didn't know, I'm a survivor myself, and 4 years, thank you. And we're not talking about disease, we're talking about cure, which is where we are now. So please join me in October, our first week, and Broad State talking about breast cancer. In addition, we're going to laugh it off October 25th with a comedy show. We're going to laugh at cancer. Thank you so much for joining me, and I'll see you next time for Healthy You. I'm Councilwoman Powell.